Thank you for listening to the Court of Public Opinion. This is a very fascinating topic. I think it will help offer insight on public health. Dr. Nadine Burke, who is on the TED circuit, which if you follow the speech or information, you'll really glean a lot of information statistically. What she addressed is a public health crisis, and I have to agree, if you have been through a childhood trauma, for someone like myself who's been diagnosed with medical problems, it really offers hope for me, at least, and for those who have suffered. And here's what is happened to some of us, which really lines up with a number. The study is called A.C.E.S. It was conducted by Dr. Roxtus and Dr. Bob Onda of the CDC in the 1990s. San Francisco Bayview, I'm sorry if I got this, I'm going to make sure I get Cal Pacific Northern California Bayview Hospital, which is the poorest neighborhood in San Francisco, where doctors had conducted quality care for free in order to understand the effects of childhood trauma, exposure to long-term effects of childhood trauma. This study, which illustrated that 7 out of 10 leading causes of death are all rooted in some form of childhood trauma. That would include substance abuse. Routine screenings also showed that long-term effects of domestic violence, mental illness, would cause different health problems in developing the human immune system and flight response. This toxic stress routine screening allows the doctors to provide an A.C.E.S score screening when diagnosing COP, depression, and suicide, and other medical concerns, including any hormonal diseases. That would include thyroid problems, etc. Under this care, this is an actual treatment plan where doctors can screen for these kind of health problems and reverse the effects of childhood trauma. This education allows doctors to use this A.C.E.S screening, which helps doctors treat patients who suffered from numerous problems. And it was because of this study that it may actually save lives. It's also done with the intention to understand pulmonary disease, hepatitis, and explains some of the neurological developmental issues that occur when involving childhood trauma that include any of drug-related problems, high-risk behavior, heart disease, adrenal stress response to the system, shows in these x-rays and an MRI scan of the brain and the brain's fear response, the reward center, that it is inhibited, which is responsible for impulse control in the frontal cortex. Now, that is a very interesting study because I've talked to social workers and people who've worked with people who suffered years of childhood trauma. When I look at some of the conditions, and they list this, and I wrote a lot of notes, so I apologize if I'm moving around here a little bit, by Dr. Nadine Burke Harris, that through this study, she was able to diagnose, properly treat, from childhood patients to adult patients who have shown over time a history of ADHD, and as brain and body development. This adverse childhood study has also helped in trying to better understand the effects of childhood trauma involving a parent's incarceration to divorce, domestic violence, drug addiction, and abuse. Meaning that the brain doesn't develop at the rate that the average person would explain the effects of childhood trauma, PTSD, etc. Now, we were trying to illustrate how we respond to health problems in a health crisis. Right now, it's underreported that childhood trauma is one of the number one underreported health crises today. In order to deal with a public health crisis and to understand how to treat patients, these list of problems associated with mental illness, to ADHD, to medical health problems can be properly handled now through this A.C.E.S study, which would actually be able to answer some of the health problems in the public health system altogether. And because of this study, there's hope. There's hope for us. There's hope for people who study the long-term effects of childhood trauma. As stated by Nadine Burke Harris, there was a study that of 98 children out of 100, if they all had exhibit the same problems associated with various types of stress disorders or stressful events in their life, each one of those children were affected by some neurological or medical problem, meaning overall the future would be very bleak. But because of the A.C.E.S study that was conducted by the CDC, that we can now properly better understand how to treat as medical professionals and what to do about the mental health crisis, including high-risk behaviors and the neurological response. This MRI scan of each person that was affected by childhood trauma showed the same signs and symptoms of the same medical problems, maybe not consistent with the same types of diagnosis, but one very consistent thing: childhood trauma. That would include any type of car accidents, etc. And this is hope. When I hear adults that have been neglected for years say that they don't matter, and they keep reminding themselves those repeat patterns of things they were either told or something was whispered in their ear or something, it makes you wonder how much of this has gone unanswered and ignored. The public health crisis that we face today and the lack of proper diagnosis could explain why so many of the health issues we face today in America. We can properly diagnose through this A.C.E.S screening how to help and treat people who have suffered long-term effects as a result of trauma. This is a very fascinating study because it explains PTSD, it explains how to treat it, how to deal with it, and how to get them into a routine medical care, which would involve holistic intervention. And let me see what else. The toxic effects of stress, asthma, and aggressive disorders that often resemble mental health care. During this screening, Dr. Harrisburg noticed that the developing immune system and that this program that they had developed called the Center for Youth Screening. These routine screenings allowed the doctors to better understand the mortality rate of a person affected over years of trauma and abuse. Everything from diagnosing pulmonary disease to high-risk behaviors, heart disease, stress conditions, to the leading cause of death, heart disease. You would include a lot of things like hygiene, all those other things in it to better understand the long-term effects and how to reverse the effects of childhood abuse trauma. Well, thank God for faith, because if we hadn't understand better why we have what I know is very much underreported is a medical crisis. It explains a lot of the things that are happening in America to the poorest neighborhoods and the debilitating health effects of child abuse or childhood trauma or trauma itself. That would include any adult trauma. That would also address the issues of dating violence, domestic violence, child abuse, alcohol, and substance abuse. It explains why the suicide rate is also very high, because the brain has not developed in the way that the brain needs to, and we can actually reverse the effects of suicide. Now, that's kind of what we've been seeing, the pattern in when somebody is going through something what we know is a cycle of abuse and suicide, which is very common, and blacking out would include that under the PTSD, that a traumatic event decreases the abilities for the body to respond properly, meaning these disorders are aggressive. So if people exhibit the signs of aggression as a result of abuse, and this is the long-term effects of childhood trauma and the signs and symptoms and what to do, meaning that we can get into a better discipline and we can learn better about the nutrition, intervention, and how to treat, and how doctors, including educators, can better understand what's going on with their students. So this is incredible. And they don't even use medication to treat it. They actually said, and this is just from what I heard at this TEDx speech, is that there's actually a way to help treat and properly diagnose children and adults with these type of medical concerns. If 98% of 100 have the same similar symptoms in their response to toxic stress, would conclude that each and the same of those 98% that this country medical intervention would be one of the most incredible miracles that could actually really truly happen for those who live in poor neighborhoods too. It's obvious it has nothing to do with where you live, because this affects everyone across the board. And now that doctors have access to what they have, the A.C.E.S study, they can better treat patients and families with these problems and learn to live relatively good lives. And I believe because of this study that we might actually better understand, instead of dwelling in the problem, what to do and how to heal and treat people with these medical problems. And I'll be the first one to say that most of my health issues have a lot to do with hormonal stress, and treating a problem like this is not done with a pill. It means getting better educated and living again. And that's very hard for somebody that's ever lived through something traumatic. That would include soldiers, that would include anyone that's been through a traumatic ordeal. And it better explains why the rate of suicide and the high-risk behaviors. It can also explain why what we've been dealing with. And that feeling of hopelessness dissipates very quickly when you finally understand what's going on here. And that's been the problem all along, is better understanding how to treat people so that they can have long, good, healthy lives and quality care, quality treatment, quality care. And that's probably the basis of everything I've learned from all this, is that over my lifetime I've noticed that the effects of childhood trauma to abuse, from separation of parents to divorce, domestic violence, all these included, would explain why we've had a public health crisis. And it also explains the response to stress, anxiety, and etc. Meaning that we've been treating a problem that's far deeper than just a mental health crisis. It's so much bigger than that. It concerns me for obvious reasons, because we risk if we ignore this, we risk the danger of not treating this the right way. And I know there's a lot of people, if you care and love your family and you know they've been through a traumatic ordeal, you want them to get medical attention, and that's the public health issue we face. So while I recognize that a lot of the programs and the investigations into childhood trauma, it can explain how they can help people who are paralyzed or handicapped or crippled by abuse or crippled by some health crisis, and that's across the board. 98 out of 100 all show signs of health issues as a result of childhood trauma. You can't get any higher than that. 98. So I don't know about that 2%. I would say that 2% is a very rare portion of those people, meaning that 2% of those people were not affected, which I find it very hard, because if you're a human being, you're going to be affected by the circumstances and surroundings and things around you. And that's a fascinating study, and I'm very happy to say that link is below if you'd like to know more information. The Court of Public Opinion is a part of the Amateur Radio Network. If you would like to continue to help support us in our research study and our continuing education on topics like this, please support us at Patreon by becoming a patron at the Court of Public Opinion.